Hi everybody, I am Dr. Pradeep Shenoy, first DNB Rheumatologist of the nation and consultant rheumatologist at Amrita Multi-Specialty Clinic, which is situated opposite KMC Atthavar and next to Chakrapani Temple in Atthavar. I am addressing you from my own clinic. In this video, we will share some lessons which I have learned from my clinical practice. Mostly, I get cases that is ladies with rheumatoid arthritis, fibromyalgia, hypertension, diabetes, hypercholesterolemia, etc. So initially I have lost few patients. Now I put my foot down and say that for all the illnesses you have, you should do allopathy only. You should not mix allopathy and other alternative system of medicines to get yourself treated. As I said, when I came to Mangalore, initially because of mixopathy, that is they mixed allopathy and probably homeopathy, and that patient had a sad demise. She died. So after that, now I put my foot down. So if you have multiple illnesses, that is patients with rheumatological illnesses are prone for other illnesses as well. So when you are getting it treated, you use for all the illnesses allopathy only. Don't do a mixopathy. Don't mix allopathy with any other alternative system of medicine. This is the first point which I would like to share. Second point is that when I prescribe drugs for 3 to 4 months together, don't buy drugs for 3 to 4 months together. You buy for 1 month. This is because if you buy drugs for 3 to 4 months, you might feel that, oh God, I have to finish this much of drugs, or your friends will tell you that so much of drugs you are taking, how are you surviving? All these kinds of unwanted comments you will have to come across. So I have already told one day at a time and keep it simple long back in my video. So if I tell you to buy 4 months of drugs, you buy drug for 1 month, and once you finish it off, buy for the second month, then for the third month, and subsequently for the fourth month. So it is something like 1 day at a time, and you are finishing off your drugs without getting hurt, without any bad thoughts. And these drugs are marketed by Drug Control General of India by doing all clinical trials. So nothing to worry. And third lesson I learned from the wards. I had gone to the oncology ward to see my patient's relative. So in the next bed, there was a gentleman who was lying down who had a carcinoma of the pancreas. He was a teetotaler. He had not consumed alcohol ever in his life. He is a non-smoker, but still he had carcinoma of the pancreas. So oncologist was on his rounds. So oncologist told that, I am very sad to inform you that you have a carcinoma of the pancreas. So the patient said, how many more years months I have left? Then I think the oncologist told 2 to 4 years. Then the patient told that I am not worried about my health. Then I was wondering why he is telling that he is not worried about his health. Immediately he told the doctor that, sir, even you have come with the return ticket. Nobody is going to remain here for longer. So you have given me 4 years time. I will finish off my social obligations and financial obligations. I will get my daughters married. I will make arrangement for my son's studies. So, which I felt is very practical. Subsequently, I started telling my patients to match their disease activity and their personal, social and financial obligations. So, this is one thing. I always tell them that that is patients with rheumatologic illness, I always tell them that this is from your genes which you have inherited from the forefathers. This is not that you have consumed alcohol and you have spoiled your liver, neither that you have smoked and you have got an heart attack. All these diseases originate from your body. So once you get or you develop these kind of illnesses, there should be 2 things which should be very much at hand. That is, one thing is that doctor should be able to recognize and make a correct diagnosis of the illness. Second point is that Medications for the same illness should be available next to your house, that is next pharmacy to your house, and they should be cheap and they should be readily available. So if these things are there, you can purchase drugs and carry on with your personal, professional and social domain. So don't get bothered by genetic disorders. Let it be cancer or let it be rheumatological diseases. I mentioned cancer also because our lessons in rheumatology are to some extent adapted from oncology. So you don't worry about falling sick. Only thing is that doctor should make the correct diagnosis and drugs for that should be readily available in the pharmacy, which should be cheap and best, and the life should go on. This is how I am now teaching my patients to go on. Thank you. Thanks a lot.